welcome to Eugene's Speech Language Therapy's weekly videos. This week I wanted to talk to everyone about end-of-life swallowing issues. This is a really hard subject. I work with people who are trying to get better. They go to a rehab facility or outpatient therapy in order to become stronger and more independent and participate more. But it's a fact of life that some of my clients don't get better and they end up passing away. And so I work with a lot of families in those scenarios. I've seen a lot of well-meaning family members try and push their loved one really hard to continue doing therapy so that they can get better. They've seen this before, the declines, and then they've seen their family member improve and get better. But there does come a point where eventually, after some ups and downs, there's a steady decline, and there are some sure signs that show you there's a really good chance that this is it, this is the end of the life. I'm not going to tell you all about every sign there might be in terms of medical signs, but in terms of what I do for speech therapy, there are some things that I have noticed. So when it comes to the swallowing challenges can be the first or one of the first signs that someone is nearing the end of their life. The body becomes weak and it starts to shut down in some ways. The muscles of the swallow weaken and that person will start to have swallowing problems. So when they eat and especially drink liquids, they might end up coughing. And you'll notice them struggling to chew and swallow. It's my job to keep people safe. When I'm working with people who are trying to get back home and independent, I will get them up to the highest level that they can eat safely, but I might downgrade it. So maybe their food has to be mashed up, maybe their drinks have to be a little bit thicker. Nobody likes that, is the problem. And so when it comes to someone's end of life, I have to take that into consideration. And professionally, if someone is passing soon and they want thin liquids, they want regular food, I say give them what they want. So that's one thing, is finding a balance between what's safe and what it is that they ask for. A lot of the time they want to eat what's safest anyway because that's easier to swallow, so it usually isn't a problem. Positioning is going to be really important, so they're going to be choking a lot easier. So you want to try as much as possible to get them sitting up to swallow anything to avoid that coughing. Obviously, small bites and small sips are going to be enough. Eventually, they'll start to become very weak and they won't be able to take in very much. So little spoonfuls of liquid. Straw might work, but sometimes the sucking mechanism can become weak and a spoon is best. Really cold and warm liquids can go down easier sometimes because it gives the body more sensory information. If someone's really struggling, you can give them ice chips. That will keep their mouth moist, let them swallow some type of liquid with less difficulty. Towards the end, one thing that I teach people to do is to take those little mouth swabs that they give you, and you can soak up water and they can chew on that to get some liquid that way. You can also take those same swabs and take a little bit of an oil, like an olive oil, drop it into water and get that on the swab, and you can use that to moisturize their mouth, because at some point they will likely become mouth breathers where their mouth is staying open and it's going to be really dry and uncomfortable. So you want to use chapstick on the lips and some type of oral moisturizer or water and oil to moisten up their tongue and their cheeks and the top of their mouth. Essentially, their appetite is going to change. So when the body is in the process of passing, the appetite will decrease. And so they're not going to want food. They're going to push it away from you. Sometimes you're going to feel the need to get them to eat and continue eating. But the truth is, you really need to follow their lead, because when you force someone who's passing to eat, their body can't use it. And so it's just causing more pain to the person. So if they're choosing not to eat anymore, then it's good to follow their lead and not force them to eat. Please let me know if you have any concerns about someone that you know who is having swallowing problems at the end of their life, or if you have any suggestions for other people or any questions for me. I put out a weekly video, and I hope to see you next time.